Hello, we can hear.
And also, can you see the presentation? I think, yeah.
Yes.
Perfect.
Would it be okay to record a meeting?
Yes. Nothing. Do you want me to record it, or do you want each one individual to record it? Do you refer?
I think you can record it too, because we have recorded the previous lectures and we cannot have access to the drive.
Okay, so I started the recording of the presentation. Perfect. First of all, you're welcome. First of all, let's establish some let's say rules. I'll start the presentation. If there are any questions, any things that misunderstood or something like this, you can interact with me. Yeah, I'm more than happy to detail all the things. Okay, so it would be very clear for you. The second thing is, after this micro course ends, we will wait for you at the hospital. From what I know, you have to come to the hospital. You already received the repartition of every group and every assistant, from what I know. Is that right? I think.
Yes.
Okay, so when you finish as quickly as you can, we can start to, you can come to the hospital. Okay, so let's start. This micro course tries to be tries to come in a competition with the course that you were being taught today by Professor Radulescu, from what I know. His course was about fractures at the upper limb. So this micro course tries to establish and try to clarify for you the type of thoracobrachial bandages that you can use in some specific types of fractures of the upper limb. Okay, it's not so pretty difficult, but what you have to know is, unfortunately, in orthopedics we use some specific names, and unfortunately for you, you have to remember them. Okay, so for example, the thoracobrachial bandages that we use, the first one of them, it's called figure of 8 bandage. Its specific names, it's called Watson-Jones. The second one, it's called the Dessau bandage. It's, let's say, the most common, most known, usually most used of the three types of thoracobrachial bandages. And the last one, it's called Robert Jones bandage. Be very careful not to confuse it with Watson-Jones, okay? Because they have the same part, Jones. So figure of 8 bandage, Watson-Jones, and the other one, it's Robert Jones. Let's start, let's say, a little quiz from what you know. Yeah. For instance, when do you know that we use the figure of 8 bandage? In what type of fractures? Do you have any idea?
During clavicular fractions.
Okay, we use them in the clavicular fractures, that's true. This is the general thing. We will try to be more specific, yeah, and because the clavicular fractures are classified depending on the localization of the fracture. There could be lateral, medial, and median, okay? Okay, so let's start to discuss a little bit. The Dessau bandage, for instance, where do we use it? You have
middle
I'm just more specific. Let's say where we can also use the Dessau bandage, for instance, for undisplaced, for instance. But be very careful at my specific explications. Yeah, for instance, if you have an undisplaced clavicular fracture, okay, the figure of 8 bandage we'll discuss about it, has a specific role. Due to its form and its type of manufacturing, tries to reduce the fracture. Okay, So the figure of 8 bandage, it's used for clavicular fracture, but in the middle third of the clavicula, the most common use of this type of bandage. The so bandage, for instance, we can use it for an undisplaced clavicular fracture, but be very careful, undisplaced, where we want just to immobilize the upper limb. But usually the diso bandage, usually it's used for the proximal part of the humerus, let's say, or for some other types of lesions. Do you have in mind another pathology? If it wasn't been taught to you, yeah, it's true that you have no clue about it. But let's start and discuss about them individually. So you have the figure of 8 bandage, or also called Watson-Jones. Its uses, as we already deduced, it's for clavicular fractures. You have the right image, a person with the clinical sign of a fracture of the clavicula in the middle part of the middle third. On the other image, can you explain me what do you see, for instance, because one of your exams will consist in interpreting the Eric's images, unfortunately for you. So you'll have to know to put a diagnosis, yeah, throughout an Eric's image. So what do you see in the lower image? Can you explain me?
A superior displacement of the middle part of the clavicle.
So the middle part of the, first of all, you have to, let's make an interaction between us, okay? The first of all, I'm interested the incidence of the Eric's. This is the first thing that you have to have in mind when you interpret it, because you have to start from 0, let's say, to clear some things for you. It's what type of incidence? It's an anterior-posterior incidence, okay? So this is the first thing. The second one is to correctly identify the anatomical region of the body. For instance, it's very easy for you because we discussed about Watson-Jones bandage. Is clear that this bone that you see in the Eric's image is the clavicula. But you have to know the anatomy of the human body to correctly correlate the Eric's image that you will have in the exam with the correct anatomical region, okay? So the next thing is to identify the anatomical region. The anatomical region, it's what? The clavicula bone, okay? And the shoulder. Yeah, we cannot see the complete shoulder, as you can see. We can, this type of Eric's shows us just the clavicula. Third thing is to identify the problem. So the problem over here is what? It's a fracture. We have to pinpoint it correctly, yeah, in the length of the bone, of the clavicula. So it's in the middle part of the clavicula, middle third. The next thing is for you to identify the type of displacement, yeah? All fractures have a specific displacement, rotation, angulation, and so on. It has to be very clear for you the types of movement from the two or the more fragments that appear to correctly describe the displacement of the fracture, okay? So, is it clear for you until now? I'm trying to be as clearly and as specific as possible for you to understand the basics, yeah? And to the conclude or the final thing for you is to have the best results at the exam. This is my wish for you, okay? Okay, so let's move on. So we have the indication for this type of bandage. The indication it's like this: non-operative treatment. It's the standard care for most clavicular fractures. So when we discuss about the most clavicle fractures, usually they are treated throughout non-operative treatment, and more specifically, the non-operative treatment refers to this type of immobilization, the Watson-Jones bandage. The indications for the surgical treatment in the case of clavicle fractures are open fractures or usually associated neurovascular injury. There are more indications for surgical treatment, but I just pinpointed you, let's say, the most important. I don't want to overwhelm you with more indications. But in general things, in general lines, let's say, these are the two main indications. So this is the figure of 8 of our Watson-Jones bandage manufacturing. As you can see, the patient should hold its shoulders in the posterior and superior part of the body. The first thing is to apply the reduction of the fracture, the reduction maneuver of the fracture of the clavicula is made throughout the positioning of the medic of its knee in the interscapular location, and tries to pull the shoulders back and upwards. And afterwards, the figure of 8 bandage is applied. As its name, its shape is similar to the 8 number. Okay. We can also use prefabricated figure of 8 bandages. Usually most figure of 8 splits are prefabricated, and its application is simple. The thing is like this. Unfortunately, most of our patients that come in our emergency room don't have the financial liberty to acquire this type of prefabricated splints. So usually they end up with a manufactured figure of 8 or Watson-Jones bandage. These are more useful, the ones that prefabricated, because they maintain their shape. Yeah, the ones that are manufactured, usually in 1 week they become very loosened and also very inefficient. So the reason why we call, for instance, if we have a patient, we put a correct diagnosis of middle third clavicular fracture, we apply this type of bandage, but we have to call him at 1 week, yeah, to reevaluate its situation, because usually this type of split of bandages become loosened and inefficient. Okay, so we have to remanufacture them. The applying method of the figure of 8 bandage is to hold the patient in the standing and its hands on the iliac crest, and shoulders should be abducted, okay, as I told you. We also have some other type of thoracobrachial bandage. It's called its sling, yeah. It's the sling's indications are for shoulder and humeral injuries like sprains and contusions. The biomechanical role of the sling is to support the weight of the arm and the shoulder, compared to the soap bandage that holds the arm against the chest to prevent the shoulder motions. So in this situation, we can compare the two types of thoracobrachial bandages. So the sling, it's only for shoulder and humeral injuries like sprains and contusions, compared to the Dessau bandage that has a supplementary role of preventing the arm and the shoulder to move in any directions from the body. Okay. So to apply the sling, you have to place the injured arm in the sling with the elbow at 90 degrees of flexion, as you can see in the image. The next step is to place the strap that is attached to the sling over the patient's head and neck so that the weight of the arm is supported by these structures. Okay? A few words about thoracobrachial bandage, and more specific to the Dessau bandage. Its name comes for Pierre-Joseph Dessau. He was born in 6 February 1738 and died on 1st of June 1795. He was a very well-known French anatomist and surgeon, and he developed this type of bandage, and in consequence, the immobilization or this type of thoracobrachial bandage gave his name. Okay, so you have an image that shows you how the Dessau bandage is applied. Okay, so if you can see, the medic or the assistant starts to apply the Dessau bandage. Usually the patient has to maintain the other arm placed on his head to permit the assistant or the medic to come and roll throughout the thoracal part of the patient to immobilize the upper limb affected. Okay. Indications for the Dessau bandage are like this: shoulder dislocations, but only after the reduction maneuver. So we apply this type of immobilization consisting of thoracobrachial bandage, or more specific the Dessau bandage, for shoulder dislocations, but only after we have the reduction maneuver applied and we are sure that the shoulder it's in its correct position, in its anatomical position. Another indication is fractures without displacement or minimal displacement of the lateral extremity of the clavicula. Okay, so coming back, the middle part of the clavicula usually consists of the treatment represented by Watson-Jones bandage, but when we have minimal or without displacement fractures of the clavicula or the lateral extremity of the clavicula, we usually use the Dessau bandage. Fractures, another indication. Excuse me just a few seconds to close the window. Okay, because it's raining outside and there's a lot of noise. Okay, I think it's better now. Okay. Another indication. Perfect. Another indication for this type of bandage are fractures without displacement or minimal displacement of the head and neck of the humerus. I can ask you, for instance, what type of classification to use for the fractures of the proximal part of the humerus. I think it was just taught to you by the course today. Do you remember the name of the classification?
Near?
That's correct. The most common classification used nowadays is the near classification. Let's make a little explication. You see, in orthopedics, unfortunately, we have to put a diagnosis throughout an imagistic investigation. Usually, in orthopedics, we use RXs, okay? Radiological images. Our role is to put a diagnosis. Afterwards, we have to classificate the type of fracture or the type of problem throughout the specific classifications. In this specific case, for instance, for the proximal part of the humerus, it's the most common used in nowadays is the near classification, because the role of the classification is like this: to show us, the type of treatment that we have to apply. The near classification. Do you remember what major criteria use? So it's meaning it's like this to show us if you want to apply a Dessau bandage, for instance, for a minimal displacement of the head and of the neck of the humerus, or we are obliged to use a surgical treatment, because this is the role or the meaning of this type of classifications, okay? So my question was, what are the new criteria that we have to apply?
Angulation more than 45 degrees and displacement of more than 1 millimeter.
That's correct. So the two things that you must have in your head and clear in your head, it's the angulation more than 45 degrees, and the other thing, it's distalization, diastasis we call it, yeah, or distance more than 1 millimeter. When you have a fracture and you put the diagnosis, you have to analyze it and classify it throughout the near classification. So this way you know what type of treatment to apply. Okay, this is the meaning. Another indication, it displaced fractures of the head and the neck of the humerus associated with contraindications of the surgical treatment. So for instance, if you have a patient with lots of comorbidities and the surgical treatment represents a high risk, unfortunately, you have to apply this type of orthopedic treatment represented by a Dessau bandage, okay? You have some examples over here, some specific types of problems. The left image, upper left image, shows you a shoulder dislocation. For instance, if you have a patient like this, do you apply a Dessau bandage and immobilization, or it's not correct? So, for instance, if you have a patient with this radiological image that comes in the emergency room, let's suppose that you are the surgeon. Okay, you are the surgeon. You are the orthopedics. So you put a diagnosis, a correct diagnosis for this emergency shoulder dislocation, and it's your decision. What do you do next? Based on your knowledge that was taught to you by now, do you apply the Dessau bandage for this patient?
No, we need to reduce it first.
Okay, so this is very important, okay? You have to reduce it. Afterwards, you have to make a correct another RX, yeah, to see if the reduction is correct and if the humor is in its correct position, anatomical position. And afterwards, you have to apply the immobilization. Another image in the upper right, what type? It's a clavicle fracture because it's already, but what type of clavicle fracture? We already discussed. It's
Lateral.
lateral third of the clavicula. So we can immobilize it with also the Dessau bandage. Another example, you have over here a humeral neck fracture. Well, you have a humeral neck fracture, you apply the near classification, and you conclude that applying this the near classification, this type of humeral neck fracture can also have a Dessau bandage immobilization. What I haven't told you is about the period that you can maintain, for instance, a Dessau bandage. How long do you think you can maintain a Dessau bandage to a patient? Let's say 3 weeks, 6 weeks, 8 weeks. Do you have any clue? Because when you apply an immobilization, there are two things that you must have in mind. The first one, you want to achieve consolidation of the fracture. If the problem or the problem of the patient is a fracture, okay, or the reason that you apply this type of immobilization is a fracture. The other thing that you always must have in mind consists of preventing problems to the other articulations that are involved in this type of immobilizations. So when you apply the soap bandage, for instance, you're obliged to maintain it for only 3 weeks, not more, yeah, not less. Usually 3-4 weeks, let's say, because there's another sensitive articulation. It's the elbow. And what type of problem do you think that appears? If you immobilize an articulation for a very long time, stiffness appears, okay? So some of our body's articulations are more sensitive to stiffness. For instance, the elbow is the most sensitive one. You cannot immobilize more than 3-4 weeks an elbow, because if you immobilize at a flexion of 90 degrees on elbow for 8 weeks, when you dismount, for instance, the bandage, you will conclude that the elbow won't move no more. It will stay in that position. So stiffness will appear. To prevent the appearance of stiffness, yeah, you have to be very careful. So to prevent it, you won't immobilize the elbow more than 3-4 weeks. Okay. So as I told you, the thoracobrachial bandage, for instance, like the Deso bandage, you cannot maintain it more than 3 weeks. This is the maximum period. You have some examples of also manufactured Deso bandages, prefabricated Deso bandages, okay, that are applied to the patients. When you have to manufacture your own Deso bandage, you must put padding with cotton wool in the specific places, like the axilla, under all the woman teeth, because and also between the arm and forearm and the body, because these parts, when skin touches skin, usually that can lead to the appearance of some specific lesions. Okay, so to prevent them, we have to apply the padding with cotton wool. Afterwards, the assistant starts to roll the first round of bandage, okay, between the arm and the thorax of the patient, and and so on, continuing to sustain the upper limb and to take the support from the above the shoulder. Upper limb has to be maintained close to the chest. Usually, for instance, when we are dealing with a fracture of the proximal part of the humerus, we have to maintain a moderate internal rotation, and the elbow, as I already told you, it's maintained at 90 degrees of flexion when we manufacture the Deso bandage. The Deso bandage is reinforced with adhesive tape. Unfortunately, also the manufactured Deso bandage can start to loosen and become inefficient. So that's also the reason why we call the patient to be seen at 1 week distance from the first appliance of the Deso bandage. And also we make we put the patient to make a specific movement of the first finger of the hand. Do you have any clue why why we as medics try to ask the patient to do this type of motion with its first finger?
To make sure that none of the nerves are compressed?
That's true. So we have to make sure that none of the nerves are problematic. For this type of movement, there's a specific nerve that we are interested in, and it's called, what's its name? It's the
Radial
nerve. That's true. Okay, so the radial nerve. The other type of immobilization that I wanted you to take in consideration is the Robert Jones bandage. Its indications are type 1 and 2 acromioclavicular joint springs, and type 3, but only at non-active patient, because high active patients usually when a type 3 spring of acromioclavicular ligaments appears, usually the type 3 Robert-Jones classification, Rockwood classification, sorry, usually they consist of surgical treatment. They consist of surgical treatment. So unfortunately, this type of lesions wasn't taught to you in this moment, but it will be taught to you in the courses when you will be taught about the acromioclavicular springs or luxations. Yeah, you will see that corresponding to them, it's a classifications called Rockwood classifications. Type 1 means just a spring. Type 2 usually means that the acromioclavicular ligaments are splitted, but the coracoclavicular ligaments are in good shape. And in type 3, unfortunately, also the acromioclavicular ligaments are split, and also the two coracoclavicular ligaments are also split. Okay, so you have to memorize that Robert-Jones bandage is used for type 1 and type 2 acromioclavicular clavicular joint. As I already told you, type 1, it's strain of the acromioclavicular ligament. The acromioclavicular joint is intact, and the coracoclavicular ligaments are also intact. Deltoid and trapezoid muscles are also intact. In type 2, the acromioclavicular joint is disrupted. We have less than 50% compared to the other shoulder vertical displacements of the vertical displacement of the clavicula. We just have a sprain of the coracoclavicular ligaments, then the coracoclavicular ligaments being intact, and also the deltoid and trapezoid muscles are intact. In type 3, in non-high active patients, okay, this is when we want to use the Robert-Jones bandage. When we have high active patients and younger patients, unfortunately, we have to apply them surgical treatment, okay, that consists in a specific type of plate or some other type of surgical procedure that we have to apply. Unfortunately, in this type or the type 3, we have the acromioclavicular ligaments and also the coracoclavicular ligaments that are disrupted. The acromioclavicular joint is dislocated, yeah, and the coracoclavicular space, it's greater than 25 to 100% compared to the other shoulder, to the normal shoulder. For instance, over here we have a specific X-ray to show you the vertical displacement of the clavicula. In the right image, you have a post-operative X-ray with this type of specific plate. It's called an acroplate. And in the lower part, you have an image with the clinical sign of the extension of the clavicula that guides us throughout the diagnosis of this type of lesion. The Robert-Jones bandage is very similar to the Dessau bandage, as you can see. The most important difference is that we have to apply with adhesive tape pressure in the lateral part of the clavicula. By applying this pressure, we will reduce the clavicular displacement. Okay, so this is the thing. They are very similar as manufacturing. The only difference consists that we have to apply with adhesive tape or some type of pressure, more pressure in the lateral part of the clavicula to reduce the displacement of it. Okay, so this was the micro course. If you have any questions. Are there any questions or not quite?
No, it was clear.
No.
Okay.
It was
So,
clear. Thank you.
okay, I'm very glad. So we will end up the presentation now, and we will wait you in the hospital to arrive. Okay?
Okay,
Thank you.
thank you.
Thank you.
You're welcome. Bye.